Hi, I'm Dr. Robert Kersner, Chair and Harvey Blank Professor of the Dr. Philip Frost Department of Dermatology and Cutaneous Surgery at the University of Miami Miller School of Medicine, and welcome to our virtual open house. It's a thrill to welcome you. If you were here in person, you might see this picture. This is the center of our medical campus with our big county hospital, Jackson Memorial Hospital, in the background. And in the foreground was the original hospital for Miami-Dade County and now is a museum. But if you take a bird's eye view, this is the entire medical campus in a circle, where the arrow points was that original picture. And University of Miami Medical Center is considered the largest medical center in the United States. If you look at the very top of the screen, you'll see downtown Miami, Biscayne Bay, and even higher in the top of the screen is Miami Beach and then the Atlantic Ocean. Now, what I'm going to tell you over the next 10 minutes is that we have the best patients. We have great faculty and mentorship. And should you come to the University of Miami, you'll also have an opportunity to contribute to dermatology through scholarship. We have a great network that you'll be part of, and the Miami dermatology tradition is rich. And of course, Miami is one of the best cities in the United States. Taken together, we believe we have the best training for residents in the United States. Part of the department legacy is leadership, including department chairs, medical school deans, academy and society presidents, journal editors, NIH leaders. And another part of our legacy is great innovation and discovery. Many diseases were described, as was their pathogenesis at the University of Miami. Novel diagnostics and new therapeutics have emerged from the University of Miami. And we're a department of many, many firsts. Here are some of the leaders that have been from the University of Miami, including the former head of NIAMS, two former chiefs of the dermatology branch at the NIH, 25 or over 25 department chairs, the founding editor of the Blue Journal, among others, including billionaires, clinical leaders in all aspects of dermatology, four presidents of the American Academy of Dermatology, University of Miami people, and the current president-elect, vice president-elect, and assistant secretary treasurer of the AAD are all Miami graduates. Now, our department has an excellent reputation of being world-class, friendly, and highly productive faculty. In fact, in 2014, before we've had our recent dramatic growth, we've already rated the number 5 program with regard to number of faculty publications. But as I'll highlight in just a moment, we've had substantial growth over the past number of years. We just celebrated our 65th anniversary. Our 60th anniversary we celebrated in 2016 by having a meeting to commemorate the 60th anniversary. It all started with our founding chair, Harvey Blank, who served as chair for nearly 30 years. Many things happened during the Harvey Blank era, including the first oral antifungal, griseofulvin. We were the first department to have a full-time dermatopathologist. We were the first department to have a Mohs unit, and we were the first department to recognize cutaneous surgery and changed our name to dermatology and cutaneous surgery, among many, many other firsts, some of which are listed here. Our second chair, Bill Eaglestein, was a leader in wound healing and certainly made many contributions. And in fact, the FDA still makes sure that vehicles are used as part of wound healing trials for products that are approved. During his time as chair, the causative agent of Seabader's itch was described. And we were the first department to have a full-time cosmetic dermatologist and cosmetic dermatology clinic. During the Larry Schachner era, many firsts occurred and many breakthroughs, including the treatment of psoriasis, the acknowledgement that it improves vascular comorbidities and vascular disease. And we also set up the first U.S. Biologics psoriasis clinic for underprivileged patients. So patients who go to Jackson Memorial Hospital and they have psoriasis, need biologics, they have access to getting these state-of-the-art therapies. Since I became chair in 2016, we've had dramatic growth, nearly over doubling of our faculty from 18 to 36 full-time faculty in both clinical and research faculty. But we also have a number of other clinicians that take care of our patients, full and part-time staff physicians and part-time research faculty, in addition to the Vibrant program, where we have 23 residents. We have the only program in the US that has a master's degree, and we have 140 voluntary faculty who contribute to our teaching and educational missions. We also have a robust mentorship program, and the goal is for every resident who comes to our program to be immersed in this mentorship program, to nurture and first create and then nurture your career goals. Well, 90% of the training is similar for all residents. That other 10% is personalized to you to make sure that you get what you need out of our training program. And including those people who want to go in academic medicine, we have a dermatology academic training program led by Dr. Ralph Paus. Now, one of the great things about Miami is our geography. We are blessed by geography, and whether we consider the catchment area South Florida, or whether we consider the catchment area the Caribbean, Central and South America, we are blessed by having great patients with who have tropical diseases, skin cancer, tertiary and quaternary care from the inner city, and referrals of many different skin types. So we're really blessed by having a great patients to learn from and to see what people read about at other programs you see at the University of Miami. We train at various hospitals and clinics. Our major hospitals include Jackson Memorial Hospital and University of Miami Hospital and Satellites. We also train at the VA Medical Center, and all three of those hospitals are on the medical center that I showed you earlier. We also have a site across the bay on Miami Beach, Mount Sinai Medical Center, where you also get to train in a community hospital setting. As I mentioned, not only do you have great mentors, great clinical experience, but you're also encouraged to contribute to the body of work known as dermatology. And as a first year, you will join a research team, and then throughout the next 2 years, you'll pick one of 3 tracks to participate in: the clinical educator track, clinical research track, or laboratory research track, so that you can contribute to the body of knowledge of our specialty. Each year, we have an annual research day where residents who complete a research project, as well as fellows and faculty, may present. The first 3 were live. The next 2 were held virtually. And this past year, we had a hybrid format of both live and virtual presentations. So in this very brief presentation, I really set out to kind of give you an overview of our program and what makes it special. But really, what we're looking for as you look at programs and as we meet with you in interviews and moving forward is Frost Dermatology and Miami the right place for you? Now, if you want to be part of a great team, if you're willing to work hard to become a great dermatologist, and if you're interested in having great fun, if you're interested in learning to reach for the greatest heights and be a difference maker in your career and for our specialty, if you want to learn how to provide the highest level care, if you're interested in contributing to dermatology and learning to innovate so that you can contribute beyond just that one patient you're seeing in the clinic and make a difference for many patients, and if you're interested in living in a vibrant, exciting, and multicultural city, then Miami and Frost Dermatology is for you. We look forward to answering all your questions that you may have in the Q&A and through these subsequent months, through the interviews, because we want you to make the right decision, because it's all about you. Thank you very much for your attention.
Hi, my name is Dr. Brian Morrison, and I'm one of the program directors here at the University of Miami, and I'd like to talk to you today about some of our teaching sites, as well as an overview of the curriculum. So these are our 4 main teaching sites. We have the Miami Veterans Hospital and its satellite in Broward. We have Jackson Memorial Hospital, which is the primary teaching site and public hospital for the Miami-Dade County. We have Mount Sinai Medical Center, as well as the University of Miami Hospital and its associated clinics. So about Jackson Memorial Hospital, as I mentioned, it is our primary teaching site. It is the public hospital for Miami-Dade County, and thus it has a tremendously diverse patient population. And one of the prime missions of the institution is to really help meet the needs of the underserved within our community. Our role there is that we have a very robust inpatient consultation service, and we run the dermatology clinics where there are a number of specialty clinics such as surgery, Hansen's disease, hair and nails, psoriasis, biologic clinic, as well as pediatric dermatology. The next site our residents spend a lot of time at is the Miami VA Hospital. And this is the primary referral center for all of South Florida. So from West Palm Beach area all the way down to Key West, patients are referred to us here in Miami. And like many VAs, it's predominantly a geriatric population. And with that comes a lot of skin cancer, as well as really interesting medical dermatology cases. And so our residents get a lot of surgery training here. We also run the inpatient consultation service at this site. We have a satellite clinic at Broward, which is the county north of Miami-Dade. And then we have specialty clinics in HIV lipoatrophy, where we treat patients with Sculptra, as well as the laser clinic. The University of Miami Hospital is really the main teaching site for our clinical faculty. So this is where we spend a lot of time with our large teaching clinical faculty. And it also houses our inpatient service, where patients are directly admitted to dermatology. So we are the primary providers for these patients, as well as the consultation services for the hospital. We have a wound care clinic. There, of course, is a tremendously diverse patient population just by virtue of our location here in South Florida, but also because the university takes Medicaid, which many community providers will not take. We have a number of satellite clinics. One is the Lennar Foundation on the main campus in Coral Gables. We also have clinics in South Miami, Coral Gables, and Miami Beach, which all of our residents rotate through. Associated with the University of Miami is Sylvester Comprehensive Cancer Center, which houses our Mohs service, as well as a consultation service for inpatient medicine and oncodermatology. And then our pigmented lesion or melanoma clinic is located here as well. Lastly is Mount Sinai Medical Center. And so this is more of a community hospital in Miami Beach that our residents spend time with Dr. Martin Zayak there, and he teaches a lot of surgical, Mohs, and aesthetic training, but we also cover the inpatient consultation service. So as you can imagine, we have a very diverse patient population, but that's also true of our very large teaching clinical faculty. And because there's so many of us, we all have a lot of a variety of interests, and this results in tons of specialty clinics. So we have acne and rosacea with Dr. Kirai, connective tissue diseases with Dr. Matterall and Ellman, cosmetics with Dr. Hu, myself, and Rosen, hair with Drs. Midova and Tosti, Hansen's disease with Dr. Matterall. This is the only one in the state, so everyone has to come down to Miami to see us here. Hidradenitis with Dr. Levtov, the inpatient dermatology service, as I mentioned, with Dr. Kurzner and Ellman, and one of the few in the country. We have itch with Dr. Josipovich, nails with Dr. Tosti and myself, patch testing with Dr. Tosti and Franca, pediatric and genoderm with Dr. Shackner, Schmidt, and Gonzalez, pigmented lesions with Dr. Jaimes, the Psoriasis Biologics clinic at Jackson run by Dr. Romanelli, which is really wonderful because it helps our patients get treatment for free, this is one of the few, if only one, in the country. We have Mohs with Drs. Nuri, Tang, and Rosen, skin of color with Woolery Lloyd, and ulcer and wound healing with Dr. Kurzner and Levtov. Regarding our clinical rotations, it's kind of a sense of what you might expect. So PGY2 is a first-year derm resident. So a first-year derm residents spend time, a lot of time on the inpatient service. They also spend time at Jackson in both the medical and surgery clinics, the VA medical and surgery clinics. They have a wound healing rotation. They rotate through the University of Miami clinics, and they help run the Hansen's disease clinic. As our second-year residents spend time on dermatopathology, Mohs surgery, rotate through the UM clinics. They have a pediatric rotation, a post-care visit rotation, melanoma and pigmented lesions rotation, and they spend time at both the VA and Jackson clinics and doing surgery there as well. And then our senior residents have more of a supervisor-like role and more autonomy as chiefs at many of these locations. So we have a Jackson chief, VA chief, a third year runs the inpatient consultation service at Jackson. We have a cosmetic rotation. They rotate through UM clinics. They go to Mount Sinai, and they also have elective time. So our educational schedule is always changing. Here's an example of what you might expect on a typical week. So on Monday at lunchtime, you have Kodachromes. On Tuesday before clinic, there's a lecture on a chapter in Bologna or Andrews. At lunchtime, Dr. Elgart lectures about pathology, and you may have an evening dermpath session. Wednesday morning is our protected academic time and didactic time for the entire department. So from 8 to 1 o'clock, we're doing things. So at 8, we start our management conference, and this is followed by either a faculty lecture or time for meetings. And then we have our grand rounds. And a couple times a month, our residents meet with Dr. Kurzer at the chairman's meeting. On Thursday, you may have a faculty lecture, and then there's something called the Miami Derm Society, which happens every 2 months, in which we have patient viewings. Our residents lecture about these very interesting patients to both the faculty and community physicians, and then it concludes with a dinner lecture, usually given by a wonderful speaker. And then on Friday during lunch, you may have a faculty lecture or journal club. Call is home call, and it's predominantly, covered by first and second year residents. So there's the person on call on weeknights is on call for the University of Miami Hospital and Jackson. And then we have a first year resident that covers Mount Sinai Monday to Thursday, and a first year resident that covers the VA hospital from Monday to Thursday. Weekend call is covered by the first year resident on the inpatient service. So they cover all 4 sites. And then holiday calls split evenly between the first year residents. There's always backup available, whether it's the Jackson consult resident, chief residents, or any of the faculty. We're always available to help take care of our patients. Our residents are encouraged to attend another number of conferences, regionally, nationally, internationally. 2 highlights are Dr. Romanelli's Dermatology to the Stars, which happens here in Miami at the department, which is a lot of fun. And then Dr. Tossi's Hair, Nail, and Cosmetic Conference in Capri, Italy, which is spectacular. Our department is very much committed to helping the community. And so we do this a number of ways, through participating in street medicine, going to a local homeless shelter, and participating in a number of health fairs. And our residents are expected to contribute to our service efforts. And then as an employee of the Public Health Trust, Jackson, our residents have great benefits. So you're allowed to join a union. You have a wonderful meal plan, discounted parking, $2,000 in educational reimbursement, 4 weeks vacation, excellent insurance, disability and life insurance, and a competitive salary for the location. So our main takeaways here are: 1, we have a large clinical faculty with numerous areas of expertise. 2, superb clinical and surgical training in a setting that really encourages to have more autonomy over time and with experience. We have an incredible patient population, very diverse, encompassing all ages, gender identities, ethnicities, skin types, sexual orientations, and religions. And our residents really have exposure to dermatology in a variety of settings, from a large institution to smaller clinical settings, which really prepare them for the future. Thank you so much for your attention.
Welcome, potential future colleagues. My name is Ralph Paus. I'm a research professor here at the Frost Dermatology Department at the University of Miami. And I'd like to tell you a bit about research opportunities in our department. I'm also the director of our dermatology academic training program, which is why I'm talking to you. In most departments, you can now wonderfully study psoriasis, atopic dermatitis, melanomas, and other forms of skin cancer. You can do all of that here as well. But what our research is distinguished by is our world-leading expertise in wound healing, itch, hair, and nail disorders. And you will, in these areas, have unique opportunities to interact with and work with globally leading experts in these areas. So if this is something that interests you particularly, Miami is the place for you. But we have a lot more to offer than that. You can get excellent dermatopathology and dermatopathology research training here, pediatric dermatology, and stem cell research. We also work on exosomes. The expectations we have to our new residents is that they develop scholarly activity. And we are here as faculty members to enthuse you, to stimulate you, to guide you, but also to challenge you, to use your brain, ask unusual questions, off the beaten track, and get excited about doing more than just what you see in the clinic. If this is for you, we are the place that has plenty to offer in this respect. You will get a lot of support in your research endeavors, and we will try time and again to keep you engaged in scholarly activity, be it in clinical research, translational, or even basic research. We love to publish, so if you are engaging in these activities, you will have great opportunities to do so with us. We would hope that when you finish residency in Miami, your horizon will have broadened beyond the care of patients with skin diseases, and you will really deeply understand skin as a biological microcosmos. Some may even call it a macrocosmos. And our faculty members will, in their various specialties, try to get you excited about what they are most excited about. You will find that in such an environment, you have optimal opportunities to find your own niche, your place in academic dermatology. If you want to start, Miami is the place for you.
Welcome to Miami. My absolute favorite part about Miami is our diversity. This melting pot of cultures, dance, and food translates into one of the most unique living experiences in the world. Whether you're a foodie, avid sports fan, or just like taking your dog out for long walks, Miami has something for everyone. We love boats in Miami. We really hope that you come here to join our dermatology family.
I'm Liz.
And I'm Josh. We're the current chief residents and wanted to share a little bit about why we love this program. Here, we are trained to be outstanding clinicians. We see a high volume of patients from diverse backgrounds in a variety of clinical settings. The faculty are outstanding and are always available to help. However, residents have significant autonomy.
We are trained to think independently and make decisions from day one. As we are about to graduate, we appreciate now more than ever this philosophy. Whether it's medical dermatology, surgery, cosmetics, pathology, or something else you are interested in, you'll be able to pursue it to the fullest extent here in Miami.
Jackson Memorial Hospital is a nonprofit public tertiary county hospital and one of the largest hospitals in the United States with 1,547 beds. We also have our thriving resident-run dermatology clinic here daily. We love working at the Jackson Clinic. Here we see the entire gamut of dermatology, from everyday bread and butter to rare and advanced diseases. We work with our core faculty here, as well as many voluntary faculty from the community. We have many specialty clinics at Jackson, including psoriasis, wound healing, hair, nails, pediatrics, and even a leprosy clinic. One of the best parts of Jackson is that this is where we have our continuity clinic as residents. You will have autonomy in driving the care of these patients and will build strong relationships with them over time. This is a special population of vulnerable patients, and we take great pride in providing the best care possible for them. At Jackson, we also have surgery clinic every Monday and Thursday morning. From cutting out skin cancers, large lipomas, keloid excisions, and complex Mohs closures, you'll be ready for anything after training at Jackson.
Next up, we'll talk about our lectures here at UM. They say the best way to learn is to teach, so many of our board prep and basic lectures are given by our fellow residents over lunch. But many of our favorites are given by experts in the field, such as Dr. Morrison, sharing his expertise of nail disorders and biopsy techniques. We also have lectures from Dr. Kersner on wound healing, Dr. Romanelli on psoriasis, Dr. Tosti on hair disorders, or Tuesdays with Dr. Elgart helping us tackle pathology. The ability to both participate in teaching via lectures while also learning from the best of the best is easily one of my favorite things about this program.
The Frost Dermatology clinics are located all throughout South Florida, with locations in Coral Gables, South Miami, Miami Beach, West Palm Beach, Deerfield, Plantation, and of course our main location in the University of Miami Medical Campus, where we see patients at 5 distinct sites.
Very important. Oh, thank you. Thank you.
Hey, this is Vishnu. I'm one of the first-year residents at the University of Miami. Here at UM, we have an amazing inpatient experience, the hallmark of which is our primary inpatient service, where we as dermatologists get to be the primary inpatient providers for patients who have dermatologic conditions that need more aggressive management. And in addition to that, we also have a robust consult service which spans multiple different hospital settings, where we get lots of training in both diagnosing and managing a broad range of pathology.
As first-year residents, we get to rotate at our wound center and work with Dr. Levtov and our chair, Dr. Kersner. We have a world-renowned wound center where we get to use the latest technologies and research-driven therapies to care for a number of skin disorders.
Here at the University of Miami, we take great pride in our surgical training. In fact, it's in our department's name. From the first week of residency, you'll be involved in surgical cases at the Jackson Memorial Hospital clinics. During your second year of residency, you'll have a 2-month dedicated Mohs rotation. During this rotation, you'll specifically work on Mohs cases with our full-time Mohs surgeons on faculty. We have 3 fellowship-trained Mohs surgeons in the department, Dr. Kayvon Nuri, Dr. Jennifer Tang, and Dr. Alex Rosen-Agan. Through this rotation, you'll learn to go from assisting to taking stages, evaluating microscopic slides, and doing complex closures. Many of our graduates go on to have surgery-centered careers and pursue further training in a Mohs fellowship.
Welcome to the VA. So the VA we get to work at as a first-year resident, a second-year resident, and a third-year resident. So you're working as a group, and it's such a fun environment to be in, and we're so lucky to get to work with the vets. It's such a unique opportunity. Here we get to do a lot of surgeries, a lot of skin checks, a lot of chemical peels, and a lot of different various procedures. And what makes it so fun is that everyone's here. So you have so many of your co-residents around you all day long.
Which always makes for a great time at the VA.
Hello, good evening and afternoon, everyone. I'm Dr. Brian Morrison, and I'm joined here by our chair, Dr. Robert Kersner, and our other program director, Dr. George Elgart. And so we're happy to answer your questions. So before I see there a number in the Q&A box, and I see there were some also submitted prior to the lecture. So I'm going to tackle a couple of those prior to the lecture. We received a number of questions about whether or not our program takes people who've completed prior residencies, and absolutely we do. In fact, one of our current chief residents, Dr. Liz Anderson, completed her pediatric residency at CHOP, and now is a dermatology resident here with us. So having completed prior residencies does not hurt your chances of matching with us. The other question I received was regarding whether or not we take foreign medical graduates, which we absolutely do. We have had a number in the past. So that is something that we do consider, and we review those applications as well.
Yeah, it won't let me do it because you guys shut it off on me.
Hi, George. So, and then the last question from the pre-submitted ones was about preference signals, how we in Miami plan on using them. So of course, like the larger group, We intend on using it to provide holistic review of your application. So if you signal us, I will personally review your application. However, last cycle, we did interview quite a number of candidates who both signaled us and our faculty felt were a good fit for our department. So it did certainly help increase the likelihood of having an interview with us if we felt, again, you were a good fit. So moving ahead to the Q&A that was submitted in the box. Hi again there, George. Welcome. Hi. So I think this is a good question for you, Dr. Kersner. How has your program changed over the past 5 years?
So we've had a significant amount of growth in the last 5 years in terms of the faculty that we've recruited, both young faculty who've created a certain energy because they're early in their careers, and also more senior people who provide mentorship. As a result of that, I think not only do we have the great patients, we now have experts in all areas of dermatology. And it really creates a robust environment for the trainees, because they know that if whoever they're seeing in clinic, they can always reach out to one of the experts to get their kind of cutting edge view of that patient.
Excellent. So moving to the next question here, it just says scores or personal background. I'm assuming they're asking what we weigh heavily while reviewing the application. We don't really, weigh scores heavily at all. We don't use it to screen out applications. We provide a holistic review of all our applicants. So test scores are not highly valued by our department. Another question was, if they were unable to rotate with the program, how would you recommend showing interest? For example, the personal statement. So absolutely, writing why specifically you're interested in our department in your personal statement is helpful to us. Probably what is more helpful now that there is a signaling process in place is to send us the signal. And that would be a way to really show a genuine interest in our program. Gentlemen, any other ideas how candidates could show interest in the department?
I think those are very good ways. And I do think that it's helpful to us to know someone who really has a strong interest in coming to Miami as a city for if there are personal reasons, or, probably more importantly, if they think that there's something special about our training.
Perfect. Here's one for you, George. What do the residents most love about the program?
Well, besides me, it's hard to say. Actually,
there was a no-brainer. Obviously, that was the answer.
No, I think that everybody who's involved in dermatology wants to have good clinical training, and I think that they all appreciate that. But I think that wherever you train, the thing that you're going to remember most and the thing that you're going to love most is your fellow residents. And I think we've been very fortunate in putting together or having show up a group of residents who get along and enjoy doing dermatology and work hard but have fun. So I think that's the most important thing in any residency, and I think we're very, very fortunate to have it here.
Oh, absolutely. Our residents are the best. And it's true, the friendships you make during your residency are ones that are lifelong. So, they are really very important. And also the friendships and connections you make with the faculty. So, all right, next question. Asking about graduating residents. How many join academia versus private practice, and how many stay at the University of Miami? Dr. Kersner.
Sure. So about 25% of our graduating residents go into academia, and probably one every year or two stays on faculty. And when we were having substantial growth, maybe there was a few each year, but probably now, as we're getting to slightly more of a slow increase as opposed to a dramatic increase, it's probably one every other year or so.
Mm-hmm. Yeah. So our next two questions are about the inpatient service. So the first one is asking, they wanted us to elaborate on it. And then also what kinds of diseases we see, how many patients are admitted. I can start with this, and you can finish it off since you're more heavily involved than I am, but I was covering last week. So I was covering for about 4 or 5 days, and we had a patient with TEN that was also being co-managed by the ICU. We had a patient with pityriasis rubra-pilaris, who was erythrodermic. We had a patient with a chronic venous leg ulcer that was super infected. We had a patient with granulomatosis with polyangiitis that we were co-managing with internal medicine. We had a number of consults from fixed drug eruptions to, things like contact dermatitis after a surgical case. Dr. Kersner, could you elaborate a little more on the sorts of things that you typically see? And they also want to know, are we the primary team, or are they predominantly co-managed by medicine? That was the other specific question asked.
Yeah, so I think patients who have widespread disease, we usually say refractory disease or severe disease, where we're able to give therapies, inpatient therapies are kind of the population that we see. So IV steroids, IV antibiotics are often the main reason people are admitted, so blistering diseases or infections. We believe that if somebody has severe skin disease, they need to be seen by experts in the skin, and we think dermatologists are experts in the skin. So we welcome taking care of those patients. If the real criteria of whether they get admitted to us or they get admitted to medicine and co-managed by us is how significant their comorbid conditions are. If they have unstable medical conditions, then they'll be admitted to medicine. But if they have stable medical conditions and their reason for their admission is for their skin, then we much rather have them on our service. That turns out to be about, on average, about 4 or 5 patients at any one time that we may be primary managing, and seeing an equal number of consults or so each day.
Fantastic, thank you. So next question was about residents volunteer at the Miami Eczema School. Absolutely. They're more than welcome to volunteer at the Miami Eczema School. Dr. Josipovich would love to have them. So, and they do volunteer there. The next question is how much time it takes to travel between the 4 training sites. So Jackson, University of Miami Hospital, and the Sylvester Cancer Center, as well as the VA hospital, are all within walking distance of one another. So they're all on one big main medical campus. The Mount Sinai Medical Center is about a 10-15 minute drive over to Miami Beach, depending on the traffic. Usually when our residents are rotating there, they're only at that site for the most part. And then we have a few of our satellite locations, South Miami, Coral Gables, where maybe it might be a 20-minute commute for most of the residents who lived in the downtown area. And typically they stay there the whole day when they go to those sites. So there isn't a tremendous amount of commuting between the sites. The next question is application with or without transitional preliminary. Not sure what that means. So of course, in order to join our program, you have to have completed an intern year, whether it's a preliminary year in medicine, pediatric surgery, or a transitional year. For the most part, we don't know what our applicants are going to decide, since they typically match that the same time they do the dermatology program. But yes, that has to be completed. The next question is, has our program ever taken a DO in the past, and are we open to taking one in the future? So to my knowledge, I don't think we have had a DO residence in the past.
Oh, we have.
Oh, we have? Oh, okay. So that's
before your time.
Okay. Well, recently we haven't, but we are certainly open to taking DO residents, their MD equivalents. And so certainly we evaluate those applications. They're not automatically excluded from the application pool, but recently we haven't, but I stand corrected. We absolutely have in the past. So moving on, is there a formal mentorship program? Absolutely. Who wants to talk about it? George, you want to talk about it?
Yeah, I mean, most people have, even faculty have mentors here. So even the senior faculty have a mentorship system, but with regard to the residents, they all choose mentors, and the program directors often act as additional mentors to people besides our formal mentees. So I think you have plenty of opportunity to build relationships that can be very long lasting with your mentors, and I still get phone calls and try to help people who maybe, I've been here a long time. I think I've been here the most of the people on this video, so I'm a relic, and I get calls all the time from people from 20 years ago. So I think that relationship between the resident and the faculty, it really lasts. And we're always keen to hear how people are doing and see if there are ways we can help. And we also learn from them, and they help us. So that's it's available to you.
Yeah. I mean, and all of them have 3 formal mentors that have been identified throughout the course of their training, that they identify by the middle towards the end of their first year of training too. So we take it pretty seriously. We want everyone to have, some guidance throughout their residency training.
And I think our mentorship program was one of the first ones at our medical center, and has acted as sort of a role model for other disciplines, medicine, surgery, and so on. So I think that, there are formal mentors and informal mentors available for all the residents, and you're expected to have 3 formal designated, I would say formal, but more designated mentors who work with, and you meet with them and on a frequent basis, and stay in touch with them with regard to your academic and clinical career.
Great. All right. So next question, what percentage of residents have taken research gap years? Well, part of that is built into our research track, where, usually PhDs, MD PhDs take a year of research before starting their clinical years. But certainly anyone could take a gap year if they were so moved to do so. Dr. Kerr, is there anything to add to that comment?
Yeah, I think that maybe the question's asking, of the people we accept into residency, how many people did a research year during medical school?
Okay.
Yeah, so I think, so I would say probably, again, I don't have the statistics, but I would probably say about 50 to 60% or so. So we take both people who don't do a gap year and those that do.
Yeah, that's true. That's true.
Yeah, it's by no means required, but I would say that in the continuing arms race of trying to get into dermatology, there's been an increase in people doing those years, and but like anything else, depends on what you do. If you're going to do something you really like and you're having fun and you're adding to your resume, it can be a good thing. But I think we've had many terrific residents who didn't take any special time before the residency and blossomed here. So it's not a requirement.
Great. All right. So next question is to speak of the culture regarding well-being, physician mental health. So certainly we are strongly in support of resident well-being and physician mental health. What are the average weekly hours like? So normal hours, well below the 80 hours that is required by the ACGME. I'd say probably 40, 50-ish, I would guess, if I were to calculate. Some, rotations are a little more work than others. Do residents ever work more than 17 hours in a 24-hour period? No, they do not. What resources are in place for overwhelmed residents or people with mental illness? So Jackson, it's a requirement of the ACGME. So Jackson has a number of resources for any resident who's feeling overwhelmed, as well as, our residents have all 3 of us to help them. So we're always available to help our residents. We want them to thrive. We don't want them to feel overwhelmed or to be suffering. So
there's access for anyone who would need it. There's access to mental health services for all the typical requirements that anyone might have. And we're very supportive that if someone needs any of that sort of help, that we try and make sure they get it. And Jackson's great about that. They take it seriously, and they make sure that the residents have access to those resources.
Absolutely.
And I will say that one of the virtues of having a big residency, first, is that we have a lot of backup. So if one person's out for whatever reason, or two people are out for whatever reason, we have no problems making sure things get done. And the second thing is that having a big residency, we've seen it all, or virtually seen it all with our residents. So it would be unusual for something to happen that we don't have experience dealing with when it comes to handling some people feeling overwhelmed or stressed or having issues in their family that they need time off for, things like that. And of course, we're invested in our residents while they're here and the rest of their lives. So it's really, we're not worrying about the short run, we're worrying about the long run and how happy and successful they'll be throughout their careers.
Absolutely. Well said. So next question, are residents able to spearhead their own research projects? Absolutely. And sometimes the faculty play a supportive role to the resident, not the other way around. And so examples of first year research projects residents have embarked on. Gentlemen, care to elaborate on some first year research projects that residents have embarked on recently?
So I'll give you a couple just to come to mind that are happening right now. One was our current chief resident, when he was a first year, got interested in, had a patient with pretibial myxedema. And then a new drug came out for thyroid eye disease, and he was able to look at the effect of that new drug for thyroid eye disease on patients with the skin disease of pretibial myxedema. So that was something that that he started as a first year. Another example that's currently ongoing is one of our residents started as a first year, looking at what defines a medical dermatologist and compared to a general dermatologist or a procedural dermatologist with regard to the number of prescriptions they write. And that's currently an ongoing project.
Wonderful.
We have such a broad faculty that I feel like if you have a good idea, there's probably someone here in our department who can help you. But it's also a big medical center, and a number of times in the past, I can think of situations where residents got involved in things that were not necessarily that derm focused, but were more basic, that sort of thing. And usually those things take a while, so those would typically start in the first year. So if you're going to be a lab researcher, I think they're open to just about anything, and I think you can find most things here. Mostly in the department, but also other resources across. There was a recent graduate who was involved in drug discovery and identifying, new molecules or new uses for old molecules. And from his very first year, he was working with, we have a computational center here where people are interested in that sort of work. And he started working on those things and found several interesting compounds that I think he ended up with patents and other background for it. So if you're interested, if you have a research interest, you can find a way to give it flight here.
Great. Thank you. I'm going to keep moving ahead because we got quite a few left. So the next two, I think I already answered. Then it's, what is the cost of living in your city? How comfortable have resident, oh, it moved for me. How comfortable have residents with families been in the past? So the cost of living in Miami was lower pre-pandemic. And so recently the cost of living in Miami has gone up compared to what it was in the past. However, our residents do live pretty comfortable lives in generally nice parts of the city. So I think that certainly they're able to live comfortably, but the cost of living in Miami has increased recently. So that is something that we, as locals, have noticed quite a change with so many people moving to the city. With it, of course, we have tons of new restaurants, more culture, nightlife. The city is really very vibrant right now, but it is coming with a cost. Do you currently have residents who are international medical graduates? I don't think currently we do. Last year, someone graduated who was. I am a second-year student without a home program. How can I make myself a competitive applicant without taking a research year? That's quite a question to answer over a Q&A. I think that requires some really one-on-one mentorship. There are a lot of things that would have to be taken into consideration. So you feel free to reach out to us individually for more discussion on that. Okay, George, here's one for you. What are you looking for in an applicant? And what are you looking for in a resident? Two different questions.
Well, I think that for an applicant, it's a competitive specialty. So we like to see people who shine in one or another of the areas. It could be that you're someone who's done super well in your medical school. It could be someone who has done something unique in their research or academic experience, or it could be just someone who's stood out. Perhaps we have kind of an interest here in sort of the socioeconomic issues, because we have some people in the city who may not represent the highest elements of society. That we talked about, the street medicine and the homeless sort of thing. So I can remember some people who stood out for those sort of things. But if you ask me what I want in a resident, I think I want somebody who loves dermatology. And it's always hard to measure that. But, I think that's what you need to let any program know, that you're really excited about that thing that you're going to do for those 3 years. And I hope that, I imagine that's most of the people who are watching. So I don't know if that'll differentiate you, but I think it's important to let people know that you care about dermatology.
How about you, Dr. Kurzer? What are you looking for in an applicant, and what are you looking for in a resident?
So I agree with George, certainly. So we're certainly looking for people who are hardworking, because success does not come easy. Overnight successes are usually years in the making, and it's the people that go the extra mile that are often the most successful. So people who are hardworking, people who work as a team and get along with other people, and because being a resident is a team sport. And then I think really loving what they do, and really to the extent that they go above and beyond to search out answers to questions, to learn more, and to be passionate about what they do. So I think if you possess those characteristics, we'd be thrilled to have you.
Couldn't agree more. Next question, opportunities for clinical research and clinical trials. Absolutely. So residents do have an opportunity to do those things, including CO2 ablative laser for keloids. So that is a yes. Should away rotators signal the program? If you did an away rotation with us, you should not. That's the official statement from the professors of dermatology. So do not signal us if you were an away rotator. What type of residents succeed? Which type of residents struggle? This is a good question. I find that gentlemen, please chime in. I find that the residents who succeed, certain people come to mind, are people who are kind of like what we're looking for in a resident, people who genuinely love dermatology. They love dermatology. They are excited to learn it. Also people who like to see patients, because we're a very busy clinical service. Our residents are working. They're not sitting around in didactics all day. We're busy seeing patients. This is not a place to come if you don't like to see patients, because we're all very busy seeing many, many patients. So people who love taking care of patients, who love dermatology, who are inquisitive and like to do research or asking questions. I feel that these people tend to thrive pretty well. Gentlemen, any other thoughts?
I think a self-starter is good in anything, but they're especially good in our residency. I think that there are so many opportunities. You just want to have someone who's going to take advantage of those opportunities.
And I would add that because we have so many faculty, residents that are flexible, because they're going to work with a lot of different attendings, and they have to kind of get used to different ways of doing things, which is a great part of the training, but you have to be flexible enough to understand that not everybody's going to do things the same way.
True. Also, we give our residents a lot of autonomy with training. And so we definitely want residents who feel comfortable, with when they have the experience, starting to take those first steps and fly as practitioners. So next question, do we have community service free clinics? Absolutely. So the university, the docs program run by the university and the medical students, it has a number of free clinics that both faculty and residents rotate through. We also worked in Camilla's house, which was a local homeless shelter, which was slightly put on hold because of COVID, but I think that one is probably going to be resuming. So yes, there are a number of things that our residents volunteer at. I wonder if you could talk about where residents end up living. Most of the residents live in downtown, Midtown, or Brickell area. So these are kind of the more Manhattanized, denser population locations in the middle of the city, because they have easy access to nightlife, restaurants, public transportation. So a lot of them live there. Some residents with larger families may decide to live elsewhere where they have a little more space or can get a home, but most residents are in those locations. How many residents does the program accept per cycle? So around 7. It varies from year to year, but on average around 7. Do the residents get to do away rotations? Absolutely, but this usually happens during their third year elective time, but we have 2 people on away rotations right now. So absolutely they do. One is in Sao Paulo, Brazil, doing research there, and the other is doing a Mohs fellowship rotation. So, and then the last one, do you take residents who've already completed? Yes, I answered that question. So hopefully I answered everyone's questions, and if not, you can reach out to Vanessa, our program coordinator, and she can forward them along to us, and we can help, make sure we answer any questions you have for us. Okay, so thank you all for your attention and for joining us today, and we wish you all the best with the application process. We know it's very stressful, but you're all really wonderful candidates, and we're rooting for you. So thank you all for joining again, and good evening.